Well, good morning. I'd like to call to order the Indiana Board of Veterinary Medicine quarterly meeting. I am establishing a quorum. We do have 5 members of the board here. First thing I'd like to do is adopt the agenda. Hopefully we all have that before us, and I'm willing to entertain a motion to adopt the agenda as it's presented to us.
Second.
Excellent. I've got a motion and a second, and we now have one more member of the board. Welcome. No worries at all. So that's excellent. Having a motion and a second on the floor, all in favor signify by saying aye.
Aye.
Opposed, same sign. Excellent. Also, before you should have the minutes from the May 7th, 2026 meeting. Hopefully we've had a chance to peruse those. Do we have any additions or corrections to those minutes that we need to take care of? Hearing none, I would accept a motion to accept the minutes as they were presented to us.
So moved.
Excellent. Got a motion and a second. Wonderful. All in favor of accepting that signify by saying aye.
Aye.
Aye. Opposed, same sign. Wonderful. All right. Minutes are now approved as written. I think we need to swear in the court reporter. Would you please stand to be sworn? Raise your right hand, state your name.
Lindy Meyer.
Lindy, do you solemnly swear that you will keep complete and true notes of all that transpires in this hearing and prepare a complete transcript thereof from your notes and faithfully perform all duties imposed upon you as an official reporter under the laws of the state of Indiana?
That's so correct.
Excellent, thank you. You may be seated. Okay, I think we're ready to start our personal appearances. Nicole Cody, please. Registered veterinary technician.
Good morning.
Good morning. Just wanted to make sure we were connected. Welcome. I looked the room over and didn't see anybody getting up, and finally Steve pointed that you were on the screen, so it took me a second. Sorry for that. Why don't you tell us a little bit of why you're here before us today?
I'm looking to get my license reinstated. I've been given an opportunity to join a high quality, high volume stay neuter clinic for cats. And that's always been a passion of mine. And I'm just hoping to get my license reinstated so that I can be a part of that mission.
I understand that you've accumulated something in the neighborhood of 50 hours of CE. Is that correct?
Yes.
Okay, that's great. Your time spent away, I read that was involved with raising some children. Is that also correct?
Yes.
Why don't you tell me about that?
About my kids.
Yeah.
I have four kids. I have 3 boys and a girl. My oldest graduated from Purdue with his master's in mechanical engineering. And my second graduated from IU with his computer science degree. And my third is an electrician. And then my daughter is currently attending Ivy Tech right now she's doing professional communications.
Well, I was trying to get a sense of how well you spent your time when you were away from veterinary medicine. It sounds like you've done a wonderful job.
Thank you.
So that's fantastic. Great. Questions from the board for her?
Looks like in recent years you've been working more as a on the human side. Is that correct?
Yes, and materials management.
But prior to that, you did work more as a veterinary assistant on staff at a vet tech program. Is that correct?
I did, yes.
So you kind of were dipping your toes back in the water for a few years then here now.
Yeah, I started back at the Vet Tech Institute at International Business College, and I was assisting with hands-on teaching of the classes there, just showing them how to do the skills that they needed. The college unfortunately closed the Fort Wayne location and moved everybody down to Indianapolis. So I ended up volunteering at Hope for Animals, which is a spay-neuter clinic. And then I got hired there and I worked there for a few years. Then I did switch into the human side, like you see.
Do you feel comfortable having been away for a little bit of time as far as getting back in? Do you feel like there's going to be a transition? What are your thoughts there?
I'm feeling very confident and comfortable with it. Even having had time away while I was raising my kids, jumping back into the Vet Tech Institute, it was a comfortable transition. I've always had a passion working with animals. I really enjoy working with cats specifically. So I feel like this is a great opportunity for me.
And do you feel your hands-on technical aspects that maybe you can't pick up through CE, you'll think you'll regain that quickly or never lost it, or how do you feel about that?
I feel really comfortable with this situation. I think I did go over and do a job shadow of the clinic I'll be at, and I feel like everything just feels like, stepping right back into where I left off.
Can you talk to us about your job description and what your role will be in your new position?
So it would be as a veterinary technician. So she's needing someone who can help her with anesthetizing the animals and prepping them for surgery. And then, of course, like monitoring them during surgery and helping recover them afterwards.
So you would be start to finish anesthesia technician, follow-up care, monitoring, intubating, all of those things.
Yeah, she doesn't intubate most of the animals, or most of the cats, unless it becomes an issue, like if they are brachycephalic or something like that, we might consider that, but most of the time it's going to be just a mask.
Do you feel comfortable like in emergency situations if there's something that develops?
Yes.
In the...
Yes, I do.
And I assume this mobile clinic is aware of your stance right now and supporting getting your license back and
Yes.
or aware of the background at all.
Yes.
Maybe I missed it, but is there another registered veterinary technician on site as well, or will you be there by yourself? What's the manpower situation?
It's a mobile clinic and it's one veterinarian, one technician. So I would be the technician.
Is there another working, but you alternate days, or will you be it?
I'll be it. She's usually working 2 to 3 days a week.
Okay. Any other questions? Can we potentially make a decision on this? I would entertain motion if anyone has a thought on how they want to handle this. I'm of a mind to grant the license. Reinstatement.
That's my recommendation today too.
Thank you, Clarence. Rather than making
Then I will make a motion that we reinstate our license.
Good. I have a motion and a second on the floor. All in favor signify by saying, do I need a roll call for this? All in favor signify by saying aye.
Aye.
Opposed, same sign. You're all set. Thank you.
Thank you.
Okay. Dr. Sprunger, Andrew,
Yes.
want to come on up?
Sure.
Have a seat?
Sure.
Thank you very much for joining us today. How are you feeling?
Good, now I'm here.
Okay. Read a little bit about what you've been dealing with. You want to tell us a little bit about that, a little bit about yourself?
Sure. Small animal veterinarian, practiced for 13 years and then took some time off due to some health concerns and cancer stuff. And now it's time to get back to it. And I kept my license active for 5 or 6 years after my diagnosis. And then during COVID, I kind of had a progression of disease and have not kept it active since. So I'm looking to see what I need to do to get my license reinstated.
Now, I read that from a good standpoint, you're doing well enough that that your benefits have been taken from you because, gosh, you successfully got better. But from a bad standpoint, you're not yet 100%.
No.
Is that correct?
No,
Or-
I get treatment every day, but they haven't decided that I'm good to go. So it is good news, but it was surprising how quickly that came about.
Okay, and treatment every day, is that at home?
Yeah,
treatment?
just oral targeted therapy for my particular tumor type. So
Congratulations
Thank you.
on winning the battle, I guess.
Yes.
That's fantastic.
Yes.
But,
it's it's a weird situation, but I suppose overall, big picture, it's good.
you get to try to rejoin our workforce.
Right, that's right.
So, excellent. Do you have employment plans
No.
already in place?
No, just kind of starting to get the ball rolling here.
Okay, all right. Thoughts or questions from the board?
You've been sort of out of it for 10 or 11 years?
Yes,
right?
coming up on 11. It's a little frightening.
Any, during that time, were there any CE events that you were able to attend? I don't know.
I did some online stuff and I did do a couple like Purdue's annual conference and after about 2020 or so, I didn't do any. I just kind of was like, well, this is looking bad and didn't plan for this. So no, I have not.
And is your goal to go back to small animal practice?
Potentially,
Still really in
Yeah,
the exploratory phase
yeah,
of that.
yeah.
But how would you envision that if you did end up in small animal practice? Would you be looking for mentorship? Would you?
probably would feel more comfortable doing that. And then there's some like surgical stuff. I can't stand that long anymore. Like my back just won't allow me. So there'd have to be some things I probably couldn't do. Yeah. But I mean, I've considered that or just, I don't know, Elanco type stuff, that avenue as well.
So in private practice, you're leaning more towards medicine cases.
Probably,
You're
yes.
doing that, which would enable you a little bit more freedom to have your mentorship and
Right.
wouldn't have to make immediate
Right.
decisions, which I think is smart going back into the field.
Yeah.
And then you'd still have your background and degree if you were to go into industry. I think we're thinking if we reinstate your license and you do private practice, some CE is probably.
Oh, yeah.
And so I need to work that into your.
Yeah.
Your license was expired in 21, does that sound right?
I think so.
I think that's what I read or wrote down here. So, and the CE that you have touched on or been involved with was prior to that?
Yes.
Would you say?
Leading up to that, yes.
Okay. So, what are you going to say?
Well, Kelly had mentioned, some CE certainly sounds appropriate. My question was going to be, how as a board can we make that happen? when we're reinstating, can we reinstate with pending or?
No, I think if you're gonna require CE, you would have to require it. He would complete it, send it in, and then I could reinstate him.
I mean, we may have reinstated licensure from a longer time frame without CE being required. I mean, I think with strong recommendation, we probably will have that accomplished. That's a consideration as well. So, other thoughts from the group? I'm certainly leaning toward reinstatement of licensure, but I'd like to hear from everybody.
As am I, but I think it sounds like you would want.
Yeah, I'd be fine with that, yeah.
Claire, can we reinstate on probation?
Yeah.
That's what
Yeah, that's an option.
So we could do that and then require CE and personal appearances or quarterly report. He could provide quarterly reports or whatever once he starts working.
we're not here to offer advice on what you should or shouldn't do, but we've discussed before in a different case, would a person rather be reinstated on probation because we needed the CE or whatever we needed versus not renewing the license today with the mindset that they get their CE, come back to us, and then there's no probation ever on their license.
I mean, the key there is, even though the probation is just to have you go get your CE, it's always there on
Right.
your license.
Right.
For whatever reason, and they'll just go, ooh, he was on probation.
Right.
And so from that standpoint, to Steve's point, you may want to say, okay, can I come back in 90 days, and in that time frame, I'll grab CE. You've only missed 2 cycles.
Okay.
And so picking up CE requirement over those 2 cycles should be pretty easy to accomplish in 90 days. And then we can issue licensure free and clear. Not trying to make this difficult for you, but also wanting you to have a spotless record.
No, that would be fine. Just get the CE.
Did you say
first.
fine or fun?
Both.
Both.
But if he doesn't have a license, you apply for a job as a private practitioner and you don't have a license yet, I don't know that 6 years of being out of the game is enough to not be able to do vaccines and rabies. And how do we not make him wait for employment?
Well, we would need to not require CE at all and just grant him licensure. And then he would just on his own, giving us his word, go get his CE. So that's a little bit of a fuzzy.
One thing with this though is it's not disciplinary probation. So I would have to check and see if that's even reportable on our end. But if it is and the order is sent to another jurisdiction, it wouldn't probably be a problem since it was just to monitor his first year, like or first 6 months or whatever, out of being out of practice for so long.
Is your goal to start working immediately?
I'm still pending an appeal. Essentially just appealing to buy time to do this stuff. So that's up in the air too. I have no idea when that's gonna happen. Everything's filed, but it could be months down the road. So I would have time to do CE now, or get started at least. I would be fine with that.
With an October kind of timeline for reinstatement.
I think how many hours are we talking?
He doesn't have to do 80 hours. It's discretionary.
Yeah, even
we're
though
in
it's
town.
2 cycles and it's 40 per cycle, we can pick what we want. And, so I would think 1 cycle of CE would be more than adequate. So,
And BOA has a bunch of free CE online, and the Purdue conference is coming up in September, so.
23 hours, I think.
you're good.
Yeah.
No, he doesn't, I'm just saying,
Now, when you said pending appeal.
Yes.
Is that for benefits, you mean?
Yes,
Okay.
yes. So, I mean, it sounds like their decision's made, which is fine. I just wanted to sort out this type of stuff before I.
Well, you've been through enough difficulty. We don't want to make it more difficult, for sure. But at the same time, we have certain things we need to do. So.
if it's just gonna be CE, you guys can make that decision now, and then he can get it submitted, and we'll reinstate him. He doesn't have to come back to the board unless you want him to. I like
That I like.
So you get it done in a month
Yep.
and you have a job starting. You just shut up for a little bit and then she can.
Perfect.
I move. We do not reinstate today, but agree to reinstate. I figure out how many CE.
Did I hear among the group that didn't think we needed a full cycle's worth or 40? Is that correct? So 20?
Okay, I think so. So I move to deny reinstatement on this date, pending automatic reinstatement after 20 hours of CE related to small animal medicine and surgery or a collection of them is submitted. for approval and
I will second that.
Excellent. Got a motion and a second on the floor. Any discussion? Let's vote. All in favor signify by saying aye.
Aye.
Opposed, same sign. I think you're on the road. You're
Thank
all
you.
set.
Thank you, guys.
You think you'll be able to stand 5 minutes to do surgery on a cat neuter?
I can do a cat neuter.
Okay. We're not going to eliminate
And you can-
surgery
you can-
entirely.
You
then.
can sit for that, yeah.
Good luck.
Thank you, guys.
All right. Continuing in the personal appearances, Dr. Dawn. Is it Gao?
Gal, yes.
Sorry, I hesitated there because I wasn't quite sure if I was going to mess that up.
No, that's fine.
I knew I had Dawn, so I started there.
So I brought with me Dr. Lisa Eller.
Doctor,
I've worked with her in the past.
okay, well, welcome.
I'm just asking for 15 minutes. Don't be overwhelmed, but I've sorted all the documents that I sent much better and highlighted for your review. May I pass these out?
Sure. We've received a
bunch.
lot
I
of
know.
information already, and maybe plenty to be able to make a decision for you, but absolutely, thank you.
Yeah.
There were a couple things that she provided that we can't open, so. Okay. Okay. This is my copy. They're just more, I didn't make enough, but you guys can use this if you want. No? Okay.
While we are leafing through some of this, would you be willing to just go ahead and give us a little background and kind of talk
course.
through what you've been through and what's going on and how you came to come before us today? That would be fabulous.
Of course. I'm from a family of 7, where my dad worked and my mom raised my 4 brothers and I. I was the first to graduate college in my family, started saving money from babysitting at 13 because I really wanted to go to college. Got an undergraduate degree, went to University of Missouri Veterinary School, worked through school to help pay for it. In there, I received scholarships, including one in the human animal bond.
I was a member and later president of a club that took pets to nursing homes and children's hospital. And part of the work I did in veterinary school was research. So when I graduated, I spent about 4 years in private practice and then transitioned into research. I was rewarded by taking care of the animals and helping the people who benefited from the research. In 2018, I moved to Virginia to work for a company that bred animals for research. The facility housed about 5,000 dogs and 60 cats at any one time. I saw between 100 and 300 animals a week and worked 10 to 13-hour days, including some weekends. There was another doctor who would cover for me when I went on vacation. Otherwise, I was on call 24/7. The doctor who covered for me left in 2021. It was tough for me even to get a day off. But I was still proud of the work I did. I got the dogs toys. I eliminated the practice that they were doing of giving 10 dogs a vaccine using the same needle. I also held vaccine clinics for the employees' pets. And they got a free exam, a $10 vaccine, and then I used that money to go towards buying the employees turkeys for Christmas. In July 2021, the facility started failing USDA inspections for things like not having enough staff to complete daily observations, being unclean, dogs having severe dental disease, staff not bringing sick dogs to my attention, only having one veterinarian, me, employees not following my orders. I was not a manager, nor did any staff report to me. I had no influence over hiring or correcting conduct. Even prior to the failed inspections, I'd been asking for 3 vet techs and another vet. I warned my boss, who was the vice president of veterinary services, of dental disease, among other things, such as severely long nails and overcrowding. In 2021, I did start looking for another job. It was difficult because I know my departure would not benefit the dogs, and that would have left them without any drugs if I left, including euthanasia drugs. I ended up resigning in mid-April 22, and the facility was raided by the federal government in May of 22 and was eventually shut down. June 26, 2025, I was arrested at my work as a small animal veterinarian and charged with 17 misdemeanor counts of animal cruelty. I was not informed of this indictment. I was not allowed to surrender voluntarily. Instead, I spent 13 days in jail in Anderson waiting for extradition to Virginia. I spent 2 days in a Virginia jail. Most of these charges were based on gossip between some of the staff and an undercover PETA spy that the facility had hired accidentally. May 4th, 2026, 10 charges were dismissed. I pled guilty to 7 charges for, and this is the prosecutor's own writing, dogs seized from in Vigo with severe dental disease requiring surgery that only could be performed by a veterinarian. I have numerous documents in these folders showing all the work I did to help the dogs with poor teeth. These dogs developed tartar by 6 months of age and had severe dental disease by 3 years of age. I worked some weekends supporting dentals that the staff was supposed to be performing annually, but it quit doing. I contacted a veterinary dentist for its advice that the company never hired. I asked for more dental machines and hookups. We only had 2 dental machines. I begged for help, and among other things, I examined all dogs over a year of age and ranked their degree of dental disease, ordering the most severe to be done first. Ultimately, the company failed, and hundreds of dogs needed dental cleanings, with many needing extractions. The statutes I was charged with state, any person who overrides, overdrives, overloads, ill-treats, or abandons any animal, whether belonging to himself or another, deprives any animal of necessary food, drink, shelter, or emergency veterinary treatment, is guilty of a Class 1 misdemeanor. That's what I was charged with. The federal government confiscated 36 dogs that needed dental extractions at the raid. Virginia charged me for those dogs. The main reason I chose to plead were due to financial exhaustion from my attorney fees and the media coverage a 5-day trial would be. After my sentencing, PETA was there for my sentencing. After my sentencing, PETA immediately contacted the news outlets, and there are some unpleasant things being said about me in the media, a lot. My sentencing ordered me to take some vet classes, 7 years probation, that may be discontinued early for good behavior, drug and alcohol testing, which they told me is just a normal part of probation. And I have to provide 720 hours of community service ordered by the judge with animals, including providing veterinary care for a nonprofit. I have no fines. I will not serve jail time. And I think my attorney summed up well what happened to me. He said, in short, Virginia has made Dr. Gao its sacrificial lamb and seeks to punish her for the crimes of others, as well as for the failings of Envigo more broadly, while outsourcing important law enforcement functions to PETA and improperly adopting the organization's flawed investigation and policy preferences. Now, I have composed a list of what all these documents are that we can flip through, and I highlighted the points that relate to the dental disease. If you would like, it takes about 10 minutes.
I feel like if anyone wants to hear more information, that's absolutely fine. We have already a lot of information, and I have a good sense in my mind based on what I've read of the condition of those dogs. And I'm okay with where we are with information at this point. If anyone wants to hear some more, that's or go through that, that's fine. Not that I don't think it's valuable or important. I just think for where the situation we're in today, we have adequate information.
Okay.
I'd like to hear from your friend
Sure.
and doctor.
And I am here on behalf of Dr. Gao, both professionally as a veterinarian, but also personally as a person. I worked with her for almost a year while she was doing small animal work. I was working at a clinic and transitioning into the chief veterinary officer role. And so we hired Dr. Gao as a replacement for me. And so I worked with her onboarding her as a small animal practitioner. She is a huge patient advocate. She consistently recommends what's best with the patient, but she's also great with clients, meeting the client where they're at. I believe exactly what her attorney summed up. You know, she's a scapegoat for a much larger problem with Envigo Labs, and she got caught up in it. There's an assistant district attorney in Virginia that targeted Dr. Gao after the federal government dropped any pending charges. And so I think this is a huge failure of our justice system, quite honestly. And she has, been through a lot. She's a good veterinarian. She's a good person. And I would hope that she can maintain her Indiana license.
And your license is active in
Yes, it is.
Indiana at this point. And any issue associated with your criminal charges is going to have to be bounced back to the Attorney General. Unfortunately, we can't make personally here any decisions or have any action happen in that regard. But we wanted you to come back before us so that we could get a better handle on what's going on from our end here. And hopefully everything's going to work out great and you'll be in good shape. But we have no formal action that we can vote on or make a decision on personally here. This has to go through the Attorney General, but I can't thank you enough for both coming to update us on your situation. Anything about what's happening right now with you that you'd like to share with us or any additional information?
I am practicing as a relief veterinarian, but I'm getting, for the past 6 months, I've had at least 40 hours a week at the same clinic. So I'm kind of settled in there. I've completed all the CE requirements that the judge required of me. And I'm working on my probation at a rural city animal shelter. I included in here on the page 24 and 25, is letter from Dr. Eller attesting to my character and my reviews at LabCorp. So excellent reviews at LabCorp. I just want my actions and reputation as an Indiana licensed veterinarian considered without all the politics and media.
Seems fair.
So I'm not misunderstanding Dr. Rodenberger. When you say go back to the Attorney General, do you mean the one in Virginia or the one here?
No, so, just so everybody, for refresher, Dr. Gao renewed her license in October and she reported the arrest and she was called in January for a personal appearance. She provided information on that, and because she had not been convicted of any crime, the board asked that she come back in July and provide an update on the criminal matter. In the meantime, she's been convicted and she's provided the material. So at this point, this isn't a hearing, so the board can't take any action. We can refer the matter to the Indiana Attorney General's office to investigate, and if they find a violation, they can bring you back before the board. But that's up to the Attorney General's office at this point.
Okay. And what's the timeline for that? Do you know? Okay.
But you have a license free and clear.
Okay.
Yeah,
Okay.
you're in good standing with us at the moment. So,
Working is actually my stress relief from all this. I've been in research forever, but now I'm in love with small animal.
awesome. Well, you've been through a lot, so good luck moving forward, and hopefully everything will work out wonderfully for you.
Okay,
Thank you for coming.
thank you. And the notebooks are yours if you want to keep them. It's easier than, it's easier than the mess that I sent through email. Okay.
You can haul them back out of here.
Will, even if the Attorney General decides not to pursue charges, will I hear something from somebody?
If they don't do anything, no.
Okay. Thank you.
No news is good news, yeah.
Thank you.
Thank you.
Thank you all.
Still under personal appearances, Leslie Morgan. Good morning.
Good morning.
Thanks for coming to see us.
No problem.
Tell us a little bit about yourself, why you're here, and what we can do for you today.
So, I'm here to get my RVT license reinstated. I've gotten it back in 2011, maybe? That sounds about right. I don't have that written down with me.
That's 2016.
Expired in 16,
Okay, so-
you got your license in 12, at least my information indicates.
So close.
Time flies.
Yes, but after I got my license, then I left veterinary practice and I didn't work at a clinic until next week when I started one again. So there wasn't really a need to do CE and to send it in and keep the license updated. So I just need to know what I need to do to get that back reinstated.
Now, back in 14,
Mhm.
when you left practice, you indicated that you were looking to pursue a different degree. At that time, what sounded fun to you? What were
So-
you wanting to do?
When I left in 2014, I was in the process of getting a degree in geology, geosciences down at IUS. And I did get that degree and I worked in the soils lab for 2 or 3 years. once I got the degree. And that, I did not like that, but it got hard, and then it got hard because they would give me a whole lot of work and it was just me. And I had the opportunity to go do something else. And I went to Chewy. That was okay, and then IDEX called and I went to IDEX, and that's been okay for 4 years.
But it kind of sounded like your hopes for advancement
When I
there
started at
did not
IDEX,
happen,
when I
kind of
started at
fell through.
IDEX, I had a lot of hope that I would be there the rest of my career. Like I would retire from IDEX. And I've been in the same position. The only thing that's changed is I went from night shift, which was really hard, to day shift, which was much better because I don't do sleeping in the day well. But I still haven't gone anywhere. I'm still in the same position I've been in. And there's no real pathway for me out of that position.
Now, are you still working
Yeah.
that job at this point?
Yeah,
And what
so-
actually do you do for them?
I am a patient sample management technician, so we get samples from veterinary clinics all over the country. And I accession those into the computer system, and then I get them routed on to where they need to go, whether that's somewhere at our lab or onto another one of the IDEX labs if we don't do the testing at all. So, yeah. So it's still somewhat animal care related, but it's very hands off. We don't have any animals there, obviously. We just get the samples in from the clinics.
Tell us about the practice that you're interested in joining.
So I'll be starting there on Tuesday. It is a small animal clinic. There are 3 veterinarians. One of them is just part-time, and she's probably going to retire in the next few years. But I've worked with all 3 of the veterinarians before. One of them contacted me through Indeed when they had an opening because she remembered having worked with me before at Hillside, which was the last one I ever worked at. So I'll be helping in surgery in the mornings. So checking patients in, getting them prepped, monitoring during anesthesia, or doing dentals, depending on what I'm on that day, I guess, and then recovering, doing the notes, and in the afternoons, discharges and appointments bundled. So that's pretty much be what I was doing before. It's just a new clinic. So a new clinic for me, anyway.
Any concerns having been out for a while, getting back into the surgical aspect of it and the hands-on versus the
Not
lab type
really.
stuff?
But I've worked in veterinary clinics for the better part of a decade, even before I was registered, so.
And have you done any CE? I know you didn't keep your license up.
I did 2 over the last week. I was like, okay, let me see what I do. So I know I'll probably have to do more, and that's fine. I just need to know how much you want me to do. Are there certain areas you want me to focus on? And then is that going to be separate from like the next renewal CE, or is that going to include it?
Well,
Good question.
those are good questions, and those are the ones we're kind of thinking through. If you know, obviously sitting here as we were talking about it previously, your license expired in 16. We're now in 26, so we got 10 years, at least 4, maybe 5 cycles of CE. So that's a lot of CE if we would make you make up all of that, which I'm pretty sure nobody sitting here wants to do that to you. However, we have to come up with some kind of a number that makes sense for you and how we're going to lay the requirement of the CE against reinstatement of your licensure. So thoughts on that from everybody?
Just a reminder that you guys just reinstated Ms. Cody after 26 years with only CE.
Okay. Mindy, you have that math figured out for us already?
Maybe you said this and I missed it, but what type of mentoring will you have at this hospital?
So there are 3 veterinarians, and I think there's 2 registered technicians there. So I'm not going to be by myself, obviously.
Okay, so you think there's 2 registered veterinarians?
I know there's one. I don't remember what she told me when I went in and talked to Dr. Tucker on last Friday.
Okay. So jumping in as a surgery tech is a big responsibility with having been out for a long time. So that's something that I would want to make sure that you're advocating for, is that you do have some good mentoring, because sometimes we don't know what we don't know.
Right, and I would expect the first at least week or so, I'm not going to be just by myself saying, here you go, right? I'll be with the other tech that's doing surgery helping her and learning how they do things there, as far as what they use for anesthesia, what they use for their pain protocols and that sort of thing. I would expect that the doctors that they're not just gonna throw me the wolves. And again, I've worked with them before, so
Okay.
pretty sure they're not gonna do that to me.
Okay, good. And a lot of the medications have changed.
Yes.
As being a pharmacist,
Yep.
you know, I definitely focus on that side of it. And we have a lot of different protocols from what we had maybe 10 years ago.
Yeah.
So I would definitely recommend, as you're doing your CE, to focus on those
Anesthesia.
new medications that are being used, so that you're comfortable using those and monitoring for the side effects.
Okay, thank you. We have some of the similar, Steve and I were just kind of chatting, we have some of the similar thoughts as to previous where either we can delay your reinstatement pending you getting the CE that we'll decide on. And then once you turn that in, we can go ahead and issue reinstatement without you having to come back necessarily. That would be a consideration. Other thoughts from the group on how to handle this, and also a number that makes sense.
Consideration of 50, but also we didn't mandate that. And because of that.
True.
And just restated that just running 20 hours. Same timeline. As an RBT, I guess I would move for 10 hours as, but not included in the next cycle. This would be separate from the next.
The only thought on the numbers is DVM versus RVT. DVMs need more hours per cycle versus the RVTs.
That's why I said 10 versus the 20. 10.
I had 16 in my mind for some reason,
Well,
sorry.
oh, 16
Well,
is
16
what
is
they're
the
requiring.
number.
Is the number.
But she's just comparing to the 20 from the previous.
I was thinking that that's half of, what is it?
40.
Yes, that's where my mind was going, sorry. So 8, 10, yeah, I'm in the same ballpark.
So what we're talking about here is potentially needing for you to get 10 hours of CE and get those turned in, and then your license will be reinstated. Until that time, you'll be basically working as an assistant until you get those hours. But hopefully that won't take very long. Kind of depends on how industrious you are and how hard you hit it and to get those. So I think that's what everybody's wanting to do. Does that sound okay for everyone?
And I know that we don't mandate what type of CE, but I would second Vince's recommendation that, you know, that the focus be on what you're going to be doing in practice, particularly the change in drug protocols, anesthesia monitoring, and sorts of things. And there's a lot of good free CE out there. Focusing on those sorts of things to help you feel more comfortable when you're.
And I'd ask more than a week. More than a week.
Okay.
Yeah, this is the possibility of things going wrong and you being there is too risky.
Not only for the practice, but just as a stress on yourself. I mean,
Right.
that's too much responsibility coming straight back into the program. So,
They always have 2 there during surgeries, so I wouldn't be alone. But more than a week was not right there with me.
Is anybody willing to put together a motion based on what we have discussed? You're very good at that.
I move to reject reinstatement of licensure today with immediate reinstatement pending 10 hours of continuing education regarding anesthesia, dated drugs and protocols, anesthesia emergencies, on top of your typical 16 hours in this licensing schedule. the submission to Brittany for immediate approval.
To clarify, so 10 to turn into Brittany, and then
Yes.
that will not
Top of the
count
16 to the
towards
regular.
the 16.
Yes.
Motion on the floor. And a second. Any discussion with that? Okay. Hearing none. All in favor, signify by saying aye.
Aye.
Opposed, same sign. Okay, you're on the road.
All right, thank you very much, guys.
Thanks for coming to see us. You still good, or does anybody need 5 minutes for any reason? Okay. Yes? Okay. We need a quick 5-minute recess. Thank you, everybody. Okay, we are back. We are at the settlement agreements. And Dr. Suba, is that correct? Not correct? Ari, Jacqueline,
Suba.
is that?
Mhm.
Okay.
Yes.
Okay. The settlement agreement before us, everyone's had a chance to peruse that, take a look at it, have a sense of what's going on with that. We need to decide whether to accept this settlement agreement or not. It appears that we have a letter of reprimand associated with this, and we have 6 hours of CE, for the most part related to either the surgery performed or the anesthesia and oxygen provided associated with it. And input on thoughts on this from the board. And apparently the entire clinic, or most of it, participated in an electrocautery safety class as part of follow-up to this. So Dr. Sunbury, do you have any commentary that you'd like to make? As I think it's okay that you're here communicating on this.
I was in on the settlement conference, and they came up with this. I discussing. I know this scenario is always my biggest fear with laser surgery around the mouth, and this is very, very similar, and very, very unfortunate occurrence. But it seemed like they made necessary, the settlement agreement made necessary changes and training. That was my take.
I agree. I think they went above and beyond to make sure that they're basically covered, and I think it was an accident and lessons were learned. I think.
Other thoughts about this? It is a scary thing that certainly can, and in this case did happen. So,
I didn't see any CE tied to this when I read through it. I just saw a letter reprimand, I think $5 fee.
maybe the CE was already performed,
Okay.
6 hours,
Gotcha.
2 hours on eyelid disorders, and an hour on hemostasis and electrosurgery, an hour on critical care and ventilation, and surgical management of the eyelids, and an hour on dyskiasis. So
As well as the training, the full clinic training on the electrocautery unit and safety. It was.
And I believe that was attached to the agreement as Exhibit A, the CEs and the course that was completed.
well, at this point, I would accept a motion to accept this settlement agreement. If anyone would provide that.
To accept the settlement.
Excellent. We have a motion and a second. All in favor signify by saying aye. Aye. Opposed, same sign. Agreement accepted.
Thank you.
Our next proposed settlement agreement, Dr. Nala Bolton, and is that pronunciation correct or not?
Yes.
Okay. Apologies if not, but it sounds like it's okay. Awesome. Okay. Here because of a surgical experience that did not go quite the way intended. And I don't know how much detail that everybody wants me to provide, but we had a GI foreign body that required surgical intervention, and then assessment of tissues, the decision to provide gastrotomy incision and enterotomy incisions, and actually an incision into the colon as well, apparently, and surgical suture dehiscence postoperatively, peritonitis ensuing, and the need to be euthanized on the table at a follow-up surgical exploration. Secondary issue involving another case is also before us here with regard to a obstructed male kitty cat and interaction associated with that, and post-experience online communications. So, thoughts regarding this, with regard to what's before us in the settlement agreement, things we need to discuss with regard to whether we think that's adequate or not adequate. So anybody want to jump in, or I'll continue to work through this for us.
Let's repeat it and ask comments and concerns.
Okay, all right. I was just trying to give a little bit of background, have something for somebody to respond to. But thoughts on this as far as whether we have adequate amount of educational aspects and restrictions or things that need to be done in this regard. Some thoughts that I have been about the monitoring of the surgeries. I've not been involved in a situation where there was a video monitoring with an elevated video of the surgical site being the way of following up on how the surgeries were done, and then having a surgeon assess those and determine it. It's just, I have trouble sometimes saying you need to change the light here because I can't see in this incisional opening to see what I'm doing, let alone having a light up above or a video up above being able to see what the surgeon is doing. So I'm struggling a little bit with the video monitoring as a way of assessing how we're doing. That's just me.
This is Deputy Attorney General Autumn Murphy, and I was one of the DAGs that helped to put together this agreement, and I'd love to speak to that concern that you have. So the agreement does outline for the respondent to be sending these surgeries contemporaneously. And the idea is that the supervisor and the respondent have discussion meetings every other month. And those issues about whether or not the supervisor can visualize the surgical field can be addressed during the first discussion meeting, and the method by which the respondent is recording the surgeries can be addressed in future recordings. The reason that we wanted to have this asynchronous type of supervision is because we do live in 2026, and we want to remain flexible to the fact that the supervision can be adequately done by video recording if the conditions of that video are correct. And this allows for both the supervisor to have more flexibility in their practice as well as the respondent. As you'll note, while there are two cases, there is only one case in this settlement that has to do with the technique of the respondent's surgical practice. The other case has to do with confidentiality.
No, I knew that. I just put it in there for discussion. Sorry about that.
Great. And so I think in terms of whether or not the video recording is adequate for the supervisor, the purpose of the settlement is to give that discussion meeting requirement so that those issues can be addressed, and going forward they can be mitigated so that future recordings are improved and the discussion meetings can be productive. But the ability to record surgeries, I think, is something that this board hasn't seen before, but it allows for more flexibility, which in a sense provides the board a better way to ensure that the respondent is improving his practice.
I'm not particularly technical, but it's hard for me to imagine the camera zooming down adequately to be able to see inside a surgical incision. How is that going to happen? Do you know? I mean, if the surgeon says, I can't see anything, I don't know what you were doing in there. Your hands were in the hole or the incisional site, and that's all I saw were your hands in there. I couldn't see tissues. I'm just struggling with how that's going to occur, unless there's a person there with a camera that's going to bring it in and do a close-up shot or something.
And if the board would prefer that, if you would prefer to have the language of the agreement be more specific as to require an assistant to be holding the camera at a precise angle, say 45 degrees, so that the surgical field can be better visualized, we can, of course, discuss modification of the settlement agreement to accommodate that concern.
I think the argument is there is no technology right now that can adequately see what the doctor is seeing caveat that the doctor himself sometimes has to be positioned, or, so it doesn't matter what angle, it doesn't matter who's in there. Talking about the procedure, it just doesn't seem like it is a valid use of technology right now.
We need to maintain sterility as well. It's
Yeah.
also complicated when you're breaking in.
I think there's more going on in the surgical setting than just the surgery site as well. And so we would want, I think any supervisor would want to be able to, see the monitoring equipment and see how the patient's responding and changes of, tissue color during things. And I have concerns about how well that can be noted with.
Or be gowned and gloved and say, here, let me take a look at what you're struggling with and give immediate feedback. And that's not gonna happen with a video.
Replacement probably needs to be.
And that feedback is well taken.
I think the board could request an amendment right now, and then if the client would agree to it, then we could get it settled today.
One other concern I had when I was looking over is, this as a supervisor who's not connected with a practice or a friend or whatever. But who is that supervisor going to be? What are their qualifications? Sometimes in past things we've had, it needed to be a board certified surgeon, or it needed to be this or that. I'm not saying that that's what it necessarily has to be, but when it just said supervisor, I feel like I would want to know who that person was, to know their qualifications. And then I also think whoever that supervisor is may have questions whether, I can't do this by video versus I need to be in there. I think, to me, there's just questions there.
Can I ask a question? Are you anticipating, if that's what you're saying, would it be does it have to be one person doing it for the entire time? Or could it, for example, I don't know if this would satisfy anyone, but if it's like a board certified surgeon has to do the supervision, would it have to be the same person throughout the duration? Or would it be satisfactory to the board, for example, if it was a board certified surgeon and there was a board certified surgeon doing each supervision? I'm just throwing that out there because I'm anticipating some issues in my own mind.
I think different boarded surgeons assessing this veterinarian surgical skills could actually be more beneficial than just the same surgeon all the time. Depending on the situation, different people looking at something, you get multiple opinions on how we're doing. So I don't look at that as a negative.
But if that was a scenario and the board wanted to know who that person was, would you be anticipating that each time the board would have to sign off? Or would it be sufficient if you establish the qualification that it has to be that? And then as long as that person proves the qualification, it's okay?
In my mind, it's the qualification. And if it wasn't going to be a board certified surgeon, I'm not saying it has to be, then I would want to know the individual person. But if it's board certified, to me, that's what I need to know.
Okay.
At that point, I don't think we have to be assessing qualification at all, because it's hard to argue with a boarded surgeon's abilities. So that'd be positive information. So, what other concerns, if any, do we have on this? I think proper assessment, feedback, and training on the areas where failure was obvious in this case is key to public and animal safety and moving forward. So that was the biggest point of concern that I had.
May I ask a question?
Sure. No.
So the component of the report of the supervisor to the board, was that something that the board would like us to retain in any future agreements?
Well, I think somehow we'll have to know what the surgeon the assessing surgeon thinks. I mean, as to how that is and how things are progressing. So the timeline, I think, was it 2 surgeries a month or something along those lines? I think within a reasonable amount of time, a report following those 2 needs to get to us. And then subsequently, same process moving forward.
So in the current agreement, it's a bi-monthly report. So it would cover 4 surgeries visualized. Is that acceptable to the board, that frequency?
I think my only concern is if we have serious issues associated with tissue handling and surgical skill, 2 months of surgeries, that's a lot of time passing and us not getting a sense of how the patient's doing. At least initially, I feel more comfortable having a report after the first 2 as to how things are going. And maybe we can extend that verbally down the road based on how things are progressing. Sure, it would come to her and she can disseminate it if wanted. I mean, this is something we all want to at least read and see how things are going.
So it's looked at before our quarterly.
A little louder, please.
Just so it is looked at by a veterinarian on our board somehow, so that we're not collecting them and putting them on the agenda for next quarterly. That's too long to review. So I was just asking about the details.
The other, just to go a different direction amongst us for a second, one of the other considerations was instead of a surgeon coming and overseeing what's being done, rather having the doctor go, for example, to Purdue's Veterinary College for a sabbatical to do the training on site there. May or may not be not necessarily easier, but easier to make happen than getting a series of boarded surgeons to rotate and share coming in. I think Ohio State probably has a surgical program that they would offer as well. That is a possibility, so at least that be a consideration. And then this is in addition to CE that we would want to dictate more so maybe than what's in the settlement.
In my mind, I'd like a sabbatical to see them doing it firsthand, being in there, them being a boarded surgeon, proper techniques and whatnot. But I don't know that I would want that to be in place of all of the personal surgeries being supervised. To me, if we did a sabbatical type thing, then maybe we don't need as many surgeries supervised firsthand, because that's kind of new training. But then needing, I still think we would want to have.
You do a combination of a
And bring down
sabbatical
the number.
and maybe instead of, what was it, 18, 10 or something like that? Is that what you're saying?
I'm sorry, I just had another question. The wet lab that's in the agreement, I didn't know that Purdue was doing anything, so is that different than the wet lab courses, like the one that's in the agreement, where you go and you pay and you do hands-on surgery?
Yes.
Okay.
This is, Dr. Shipman actually talked to Dr. Marsh, and although there's not officially availability, the indication was it could make that happen. Is that a fair statement?
So it would be one-on-one with the surgeon, like a shadowing experience of one person. Right.
Fantastic.
There may be a cost component to it.
But I'd like to do that. Although it's probably too late for me, but regardless, that's, I think, a wonderful thing.
Could I ask a clarifying question? So if the parties are able to come to a second agreement, we would have to include language about that sabbatical experience. So you mentioned that there wasn't official availability. Is it something that if it were to appear in a settlement agreement, it would be acceptable to Purdue or Ohio State to receive that with the force of the board's order? I'm just kind of concerned that it's not an official arrangement and the board orders it, that might cause some friction.
Yeah, the understanding I got from Dean Marsh was that they, have him having been familiar with this process, as previously in my position, he is familiar with kind of the way the Board of Veterinary Medicine works and will work with his team of faculty to meet the needs of the respondent practitioner toward they historically there was a formal program that they could just enter into. But I think, in the conversation at least I had with him yesterday, this was something that they'd be able to accommodate with their team. So.
Because the position I don't want to put the respondent in out of a position of fairness is for it to have the binding effect on the respondent, but then him to approach the faculty and then not have availability beyond when the agreement contemplates that he would need to complete it. So that's just a concern that I have in terms of feasibility and fairness.
Could we potentially have it more wide open and not specify Purdue or Ohio State, but say a surgical sabbatical with under direction of a board certified surgeon? Is that a possibility?
Yeah, so like 40 hours with a board certified surgeon or a sabbatical type program at Purdue or Ohio State.
I would say any AVMA Council of Education, like an accredited institution, which would open any veterinary college across the country as well.
Sorry, I'm just a little confused. We've talked about a lot of things and I want to make sure I understand. So the thought is, Dr. Sunbury, what you're saying is either a program, if Dr. Marsh is able to accommodate, or something akin through an AVMA affiliated college. Okay, I got that. Plus what?
I don't think we can take that in place of all of the 18 supervised surgeries because, the sabbatical is one-on-one or something very similar, but and it's going to be hands-on, but probably is not going to be doing the entire surgery and whatnot. And so what is learned through that, I think some supervised surgeries, but we could bring that number down from 18 to 10 or something, I think that's.
So what about the 24-hour hands-on continuing education? You said that didn't count as a sabbatical, but.
Just the Viticus lab, wet
Yeah,
lab.
the wet lab. Feels like that's a little bit of overlap into the sabbatical, do we adjust the hours that we're talking about to accommodate the fact that we're doing 24 hours of hands-on CE in the field that we're interested in? So we're looking at your 25 hours sabbatical, a 24-hour CE, and your 10.
The CE being a wet lab, but it's probably not,
Average,
yes,
probably
right?
average.
And so when we're talking tissue perfusion and whatnot, I think it's good to get the skills,
Maybe
but
this could just take the place of doing both observed surgeries plus a sabbatical. Do we need that other?
That's my
CE?
question.
Yeah.
It seems
I
onerous to have
would
both.
eliminate that if I was doing anything and not reduce the hours of the sabbatical. Or-
yes, I would rather that.
Okay.
So.
We can either accept it or.
Interesting, right here.
and see how good.
Okay, we've made a number of converse changes to the settlement agreement. And so at this point, we simply cannot accept the settlement agreement as it's written. So I'm going to be looking for a motion to deny or reject this agreement. And then I want to chat with regard to where to go from here. So I'm looking for a motion.
I'll motion to reject.
Motion is second. Any further discussion before a vote? All in favor of the motion to deny or reject the settlement, please say aye. 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 Opposed, same sign. Okay. We have two possibilities here. One is if you can come to an agreement on the new settlement, a new settlement agreement based on what we've discussed and are looking for, and can get that back to us, we will put the hearing to the last hearing, and you'll have the time frame from now until then to provide us with an additional settlement agreement. Otherwise, we'll go into the hearing.
So Dr. Rosenbarger, I would like to provide a third option. So the parties.
That's way too confusing.
So the parties on Monday filed a motion to continue in the event of settlement denial. And I would like to orally move to reconsider that motion. It was denied by your board director. And we do.
Not denied by me, it was denied by board members.
My recommendation would be to approve your motion. I know Brittany didn't like it, but
I talked to the officers, and they're the ones who denied the motion to continue.
we had an email discussion where you didn't like that idea, but I just want to let the board know that I think it's reasonable to not have the trial today. If they're going to amend that proposed settlement.
And just for the record, I'm going to join in the renewed motion to continue in the event of settlement denial. Although, based on the board's comments, which I appreciate, I think there is a realistic possibility that we can meet Dr. Rodenbarger's timeframe to come up with a revised agreement today. But to the extent we can't, I am joining the state's renewed motion.
And the state.
And heard, well appreciated and heard. My concern is continuances just kick the ball down the can down the road a ways, and we're continuing to not to be negative, but we're continuing to perform surgeries, maybe with the need of additional training, and we're that far down the road. And I think it would be in the board and in public and animals' best interest to get this accomplished and the educational process started as soon as possible.
And I would say it's simply like the client's already paid for that course, Leviticus course. It's happening, like he's going on it. So that's coming up in very soon as well. So it's going to happen. That's going to happen regardless.
Okay, that could potentially adjust the number of absorbed surgeries, a small amount or something to adjust for that.
So one consideration I would like the board to hold close is that we don't want to have a record where we have treated some respondents differently than others. And in our motion, we outlined how this respondent's procedural history has differed from other respondents that are before this board. And so the state has a concern that if we proceed to a hearing today, we create a record that this respondent was not treated the same as other respondents have been, to be given that opportunity to have time and space to reconsider settlement and agree with the board as to the appropriate disposition of this case. And so I would ask you to consider, out of the spirit of fairness, whether it is appropriate to treat this respondent differently today. And we have paper copies of the motion if you'd like to take a moment to review them.
Okay, I'd like to take the motion under advisement. My hope is that we're really close on the settlement and that you can make that happen by the time we get to the hearing, and it will be a moot issue for us, and we can make this work out in both the respondent, everybody's favor, and be what we want to do. Otherwise, we'll address that motion if you can't provide a settlement agreement that's okay for all three groups. Is that reasonable?
It is. Thank you.
Thank you.
Okay. All right.
Thank you.
Go get busy. Figure out what we
Terrence.
No, I got that. That's good. I just looked at it. I actually had it. I just, Dr. Terrence.
I don't think he's here. Is he here?
No.
Oh, he's not here. Okay. And is it Kaiser or Kaiser? Yes?
Yes,
One of them?
yeah.
Okay, fair enough. We're all on the same page, confusion. All right. This is proposed settlement agreement for Dr. Kaiser or Kaiser regard to fracture repair in 2022 and not going well. And we have significant information on this. We've got some CE and on both what he's got going on and record keeping. Comments on this case. Elbow fracture, proper cast placement, pressure, sores, and necrosis, breakdown of the surgical site. Thoughts?
My question on the under 39B, as far as the agreement, respondent shall undergo advanced training in orthopedic surgery by either completing the internal fixation training by Ohio State or being a practitioner sabbatical at Purdue. So basically what we were talking about before. Is there any hours? Is there any time? I mean, is it?
Well, no orthopedics.
So the last meeting, we recommended that she follow, or that the parties follow the SASO agreement. And it's written exactly the way the SASO agreement is written. It also says that he will not do any orthopedic surgery until he does one or one of those programs. So I think that is the limitation.
I just didn't know if we needed, or if there was such a, like when we say how many CE hours, we give them how many hours, and when we have advanced training and sabbatical, and we didn't really bring it up for, is there a time? That's the only, and I'm not nitpicking. Yeah, I didn't know if there was a set thing, like with CE, we've got set hours. I didn't know with a sabbatical. Is the sabbatical 2 days, is it a week? And I'm asking out of ignorance, not out of.
I think it would have to be consistent with whatever the Ohio State program is.
Okay. I will take that.
Jason's gonna murder you.
When you're-
I'm just following board instructions, because I.
Understand.
Help me a little bit on this sabbatical business. So depending on the situation and just the luck of the week, for times when there aren't that many, I can think of 3 weeks of surgery block at the fourth. You may get hot or you may not, and I'm not sure stay indoors are quite to the degree that we're thinking about. And then rather than hours, should we say, yeah, cases. And what cases we want. And that's hard to plan. So I'm just throwing the extra like little bit, spending 2 weeks there might get you in how it's laid out.
Yeah, is that more predictable?
This was board precedent, and Dr. Clemente knows everything about what you guys are asking. He's not here, so. I think the last time it was discussed is that he's probably not ever gonna do surgery again.
That's good.
And that this is
Just in case.
formality, yeah.
Just to make sure we provide a path off if you can.
And I'm comfortable.
And I'm comfortable with this as written. I just wanted to bring that up, and maybe something we think about
Whatever we decide here.
in the
We can be
future.
visiting shortly.
Well, we've bounced this several times, and we need to make a decision on this today. So
I'll make a motion that we accept this, whatever as written.
I'll second that. Discussion? I do think we're comfortable that likely no orthopedic surgery is going to be approved. But we have
We have things in place.
to cover us.
So we don't want to add the detail about time of surgery. It'd be more,
He can report that if he decides to do it.
it'd be more related to the reports of the surgeons. The onus is going to be on them because they can report, we had these many surgeries, I feel like. It's just not a good representation of what they.
The board wanted to initially say you could never do orthopedic surgery again, and that you guys you can't do that unless you keep them on probation. Forever, but you guys have some way to come off probation if he chooses to. That's why it's written the way that it's written. I'm guessing that when the Dr. Sasso case went through, that the Purdue sabbatical program had definition to it.
Gotcha.
You know what I mean? And so that's probably why that was written that way.
So that might be written.
I can remember years ago seeing Purdue advertise, and it had a duration on it or whatever, how long it's about. You know, if you're interested, you could always do this, just come in and like, if you're bad or whatever, just a notice for veterinarians if you ever wanted to do one. And that's been several years back, but it did have a timeline. So I'm guessing that there is now that we're having this discussion.
Well, I would like to hope that if the caseload is low with regard to fracture repair or something along those lines, that the surgeon, the ortho surgeon that he's assigned to would have sit-down discussions on, proper fixation or other things along those lines that he would be talking through if they were doing procedures. So hopefully we'd continue to get good continuing education and have a good experience regardless.
My apologies, I'm not trying to beat a dead horse, I'm just new, so I'm learning too, but there's no post-supervision cases on this agreement. I'm just worried that we're going to see this discussion.
This is a one-off on a very specific type of surgery. I think that's why. I don't think he plans on ever doing this again. This is,
But I don't think
Just
we can
retiring.
say that, right? Like, we have given him a path, so.
So another, I guess, overriding thought process of mine is, it's indefinite probation, not less than 1 year. It doesn't say probation for 1 year, and if you do these things, you get off. You still have to come before us. We still have to, okay, I took this sabbatical, I did the CE. I'm asking to come off probation, but.
And that
but
probation
we
includes no orthopedic surgery while on
Yes.
probation.
Why probation? So then when he would appear before us again, it's not, you will come off probation in a year. That's the earliest you can. And he has to be seen before us, and then we decide.
And we will have been able to assess
And we can
what his
assess
training
what he-
was
yes.
and how well he has done on that.
So that would be our way of
Just to be devil's advocate, we can't ask him to do all these things and then change the rules of the game in a year and say, now we want you to be supervised or have 5 surgeries that are supervised.
well, I mean, you actually could, because it's whether the probation should be modified or withdrawn. So if there was something that was insufficient, then there would be a hearing on the modification.
We would have to have a hearing, at which point we could have new
So if he
stipulations
said she
associated.
didn't actually get to do any surgery this sabbatical, he just talked to the surgeon. Now we have the ability to
modify.
the surgeon. Then I'm more comfortable.
Okay, very good. Any other discussion? Okay, let's vote on this settlement agreement. All in favor signify by saying aye.
Aye.
Opposed, same sign. Okay.
Thank you.
wasn't a critique, it's just, it's like the revolving case that continues to be here. Okay, to move on to administrative hearings. Dr. Fleck. Good morning.
Good morning.
Good morning.
Mr. Chairman, for your records, my name is Dave Coots, C-O-O-T-S. I'm an attorney with the law firm of Coots, Inc. and Wheeler, 255 East Carmel Drive in Carmel, representing Dr. Timothy Fleck. We were last here in October, at which time the board entered an order that put Dr. Fleck on probation for a minimum of 90 days, conditioned upon completing 6 hours of CE, 3 of which shall be abdominal anatomy.
Excuse me, I need to get our hearing opened up, and then you'll have an opportunity to do that, if that's okay.
That's fine.
I appreciate your eagerness, but I'm gonna be shot if I don't take care of that. So anyway, let's go ahead and get started. This is an administrative hearing being held on July 30th, 2026 at 1202 East 38th Street, Discovery Hall, Suite 100, Indianapolis, Indiana, 46205, and electronically through Microsoft Teams at 10:51 a.m. local time. This hearing is being conducted pursuant to the laws of the state of Indiana, found in Indiana Code 4-21.5, before 6 members of the Indiana Board of Veterinary Medicine in a cause docketed as administrative cause number 2024 VB0013. The notice of time and place of this hearing was emailed to counsel for the respondent as provided by law on May 14th, 2026. The purpose of this hearing is to consider whether the board should modify or withdraw the probation status of the respondent's license. My name is Jerry Rodenbarger, and I am serving as hearing officer for this board. The following members of the board are sitting with me on this hearing: Stephen Sunbury, DVM, Tracy Gillespie, DVM, Kelly Peelman, DVM, Dee Anderson, RVT, Natalie Goodwin, consumer member. At this time, I'll request that any board member who feels that he or she cannot give this individual a fair hearing and render an impartial decision to remove himself or herself from this hearing. Okay. Do we have appearance of counsel, please?
My name is Dave Coots. I'm an attorney with the law firm of Coots, Inc. and Wheeler, located at 255 East Carmel Drive, Carmel, Indiana. I'm here representing Dr. Timothy Fleck, and I'll not repeat what I recited earlier, but we are here having submitted a petition to terminate the probation of Dr. Fleck that was entered in October 2025, Dr. Fleck having complied with the conditions of that probation being 6 hours of continuing education, 3 of which shall be abdominal exploratory surgery and 3 abdominal anatomy. Those courses to be approved by Dr. Clemente and/or Dr. Shipman, I believe, that he pay the appropriate fee, which he has paid. He has completed 9.5 hours of continuing education in the areas of abdomen progression, abdomen manuality progression, abdominal exploration, and gastrointestinal surgery. And the certification of those courses that he has completed have been submitted to the department. So with that, I would ask that the board terminate the probationary period, and if there are any questions regarding the CE that Dr. Fleck took, he is more than happy to respond to those questions.
Thank you. As a potential witness, Dr. Fleck, would you stand, please? Raise your right hand to be sworn. Do you solemnly swear, affirm that the testimony you may give or are about to give in this cause will be the truth, the whole truth, and nothing but the truth?
I do.
Thank you. You may be seated. Parties in this matter are hereby notified that the board will take official judicial notice of its file and record in this matter. All individuals attending this meeting are hereby placed on notice that this meeting is being recorded pursuant to Indiana law and will be a matter of public record. Do you have any further opening statement that you'd like to make?
No, sir. Thank you.
Okay. Do you have any interaction that you want to have with the witness, ask any questions or anything for him?
No, we have submitted to you all.
Okay,
the
no, I'm
certification.
aware of that. I just didn't know whether you two had any interaction. Questions from the board to Dr. Fleck? I guess I'll ask a couple with regard to ultrasonography and ultrasound guided surgical procedures. How is that going? And I've just never used an ultrasound to identify a testicle, for example. And so how has your surgical CE or continued work with the ultrasound, has that put you in a better place, or how do you feel about that at this point?
The surgical course was about 3.5 hours. I have probably paid for that course 3 times over with what I picked up in the course and going through the course. So it was quite good as far as informative. Ultrasound, we've had an ultrasound for at least 40 years. It's always been gray and white and never did anything. The Sonopath ultrasound course was phenomenally good as far as how to go through, how to use it, how to not use it. Unfortunately, our good ultrasound decided to have the blue screen of death, and they no longer will they no longer support that machine. So we have been using one of the little butterflies that you can hook to your phone or to iPad. And it is, by taking the course and using that ultrasound, we pretty well use that daily for identification of something. But the course itself was excellent. So continuing education, I wish I'd done some of that. I wish it had been available 20, 30, 40 years ago. And that would have been very good for that. As far as using an ultrasound to identify, we started using ultrasound in reproduction of our horses and got pretty well, and you understand how that is well. Dr. Binker practiced in our practice for a long time. He had one of the first ultrasounds around. And so we have been very close with him and with our breeding program and then with our ultrasound. So we've used a ultrasound in the breeding program for probably 25 years, somewhere along in there. And so, you know, you learn, but it's there. occasionally you'll try to identify something on a stallion, but predominantly you're looking at ovaries and whatnot. In the surgery that we did, we had just gotten the butterfly and we tried to identify the retained testicle, which the majority of the retained testicles that I had found are on the right side of they're the right testicle on the animal. And they're generally between the bladder and the kidney and this. So I did my exploratory, but I had ultrasounded the dog beforehand. And in the inguinal ring was the prostate, which is very similar looking to the testicle, especially a retained testicle, a small one. That's how I got in trouble, because I don't need to look much farther than this, a quick abdominal exploration. I didn't find it. I already know that it's in the inguinal ring. I've never seen a prostate in an inguinal ring, hence I removed the prostate. So that's why I took the ultrasound course. That's why I did the surgery course. And if I were asked to do a retained testicle, which I have been probably 10 or 12 times, no, I refuse it. If I had the opportunity to get a boxer puppy about a year ago that had a retained testicle, I would have taken it and operated on it. Wouldn't have bothered me at all. But do I do it for clients now? Yeah, we can refer them. So.
Was the ultrasound course, I wasn't sure based on what was submitted, was it in person or was it virtual, or how?
It was virtual, it's online.
Okay.
Yeah. And I mean, excellent. And I've had 3 or 4 or 5 other ultrasound courses in that. Nowhere near what the quality of this one was. So.
Other comments or questions, concerns for Dr. Fleck?
As someone who does a lot of ultrasound, I share your concerns as far as the way a prostate and a testicle look on ultrasound are very similar. They're very dense. They do look similar. And that this isn't the first time I've seen this surgery go wrong too. So it's not unheard of, but obviously it's devastating. It's a devastating error. It's unsolvable.
Definitely is. This was not my first.
Right.
Okay, and that was.
I didn't figure that it was,
Yeah.
But it's, I guess, and you said that in future, you're not particularly interested in performing this surgery again. Is there a way to accommodate supervision if you did decide to do that surgery again? In the context of other discussions that we've had today.
And this is all pretty much past, but to your comments about them looking the same on ultrasound or reasonably the same, I've done a lot of retained testicles, and we cheat now and use minimally invasive laparoscopy and blow up the abdomen with gas, and you can see everything and that kind of thing. So it makes it a lot easier. But if not, and you're just having an incision, my thoughts in hearing about this and what you're struggling with, I still would think that once visualized, I don't really feel that a testicle and a prostate look that much alike. I mean, so I would worry that, I don't know, and I'm not being critical, that maybe you're trying to make an incision or a surgical procedure out of too small of an incision and didn't have good visibility or something. There had to be something more, I guess I would say. So if I were, who am I to counsel, that if I were to, I guess I would strive for more visibility and exposure, for me anyway.
I mean, I'm no surgeon, so
it's easy for me to say because when you've got a blown up abdomen with gas and you can visualize everything, that's a sweet way to go. So, but regardless, any other questions or?
Probably didn't really answer your.
No, because this is a unique error, unique to this type of surgery that doesn't necessarily translate to surgical concerns in my mind in other body cavities, but.
Well, that's why I spoke to enhancing our, our visibility by extending our incisions in a case like that. I agree with you. As far as needing more education in different areas. Unless that's not what you were getting at.
My concern is mostly with this surgery, not the surgeon specifically.
Not surgical skill, it was a decision.
Correct, in this moment, because this is a difficult area sometimes to visualize when, especially if we're in the inguinal now, not in the abdomen, we're off to the side and maybe have a small incision. I guess that is my concern is like, should we be here again, that would.
I think he's confirmed that he's referring these at this point.
And is that sufficient? Like we don't have that.
I think based on what we have done in the past and what we have seen in this particular case, I think this is reasonable.
I'm new, so I'm learning too, but
I would like to point out that we are here to determine our compliance with the order that was entered in October. And I appreciate your being new to this matter and your interest in the subject matter. But Dr. Fleck has complied with what we have been asked to do, and we are seeking a termination of this probation.
And that's not a given. And so we are discussing whether we're going to want to do that.
Understood.
Or
to change it in any way. So.
I do agree that he's completed.
But I would just caution that if the standard is that if you feel that he's basically been remediated, if you feel like he hasn't been remediated, then I think that you can modify, but I don't know if that's necessary.
I don't think that's where we're headed, but the point was, it's not an automatic that that's going to happen. That was my thought. So, any further questions? Okay, let's move forward then. Do you have any kind of closing commentary or statement that you'd like to make?
Nothing further.
Okay, thank you. These proceedings, according to notice, are hereby concluded. This cause is therefore adjourned until further notice. Thank you for coming. Okay. Thoughts on how we want to handle this? Because I'm frankly ready to accept a motion to go ahead and remove probation from his license.
I move to terminate Dr. Fleck's probation and reinstate this.
Second that.
Okay, I have a motion and a second on the floor. Any further discussion? Hearing none. All those in favor signify by saying aye.
Aye.
Aye. Opposed, same sign. Thanks for coming to see us.
Thank you all very much. Appreciate it.
Take care, Tim.
I definitely will.
Good man.
Can I get 3 minutes?
3? We will take another small break before we move on. We are back and ready to reconvene. We're in administrative hearings and we're ready for Amy Graves. Amy? Hello, can you hear us? We can't hear you.
She's not. She's not.
She might just have her volume all the way down then.
Can you turn your volume up? We can't hear you.
She has it up.
Yeah, within the Teams meeting, you should see the option for the mic with a downward caret. Click it and make sure the correct microphone is selected on your computer so we can. Okay. The other thing you might want to do is, if you do have the access readily available, you may want to leave the meeting and try rejoining, and that might trigger it to accept the correct microphone. Okay. Yep.
Before or after my issues with Teams, my computer did update.
We could do all those in person.
It's kind of nice not being on video and just talk.
Can you hear me now?
Yes.
Hey,
Sorry, I had to do it from my phone. My work computer's not working on me, so.
that's okay. We're going to go ahead and you can hear us all right?
Yes, I can.
Awesome. We're going to go ahead and start your administrative hearing, okay? This is an administrative hearing being held on July 30th, 2026 at 1202 East 38th Street, Discovery Hall, Suite 100, Indianapolis, Indiana, 46205, and electronically through Microsoft Teams at 11:25 a.m. local time. This hearing is being conducted pursuant to the laws of the state of Indiana found in Indiana Code 4-21.5 before 6 members of the Indiana Board of Veterinary Medicine in a cause docketed as administrative cause number 2026 VB0008. The notice of time and place of this hearing was emailed to the respondent as provided by law on July 6, 2026. The purpose of this hearing is to consider whether the board should modify or withdraw the probation status of the respondent's license. My name is Jerry Rodenbarger, and I am serving as hearing officer for this board. The following members of the board are sitting with me on this hearing: Stephen Sunbury, DVM, Tracy Gillespie, DVM, Kelly Peelman, DVM, Mindy Anderson, RVT, Natalie Goodwin, consumer member. At this time, I will request that any board member who feels that he or she cannot give this individual a fair hearing and render an impartial decision to remove himself or herself from this hearing. You do understand that you have the right to be represented by an attorney in this matter.
Yes.
Do you wish to proceed without an attorney present?
Yes.
Okay, thank you. Since we will be questioning you, would you please stand and raise your right hand? I need to swear you in. Do you solemnly swear or affirm that the testimony you are about to give in this cause will be the truth, the whole truth, and nothing but the truth?
I do.
Excellent. Please be seated. Parties in this matter are hereby notified that the board will take official judicial notice of its file and record in this matter. All individuals attending this meeting are hereby placed on notice that the meeting is being recorded pursuant to Indiana law and will be a matter of public record. Would you like to make an opening statement?
I've done everything I've been asked to do. I'm following all the directions from the state as well as from the legal side of everything. And I just would like to, move forward and put this all behind us.
I can imagine. So understand absolutely, completely. Trying to find your paperwork. I got it moved around here a little bit. Sorry about that. So how are things going with regard to the reasons that you got in trouble in the first place?
Right. Like I talked about it the last time, I'm not a big drinker. I was going through some personal issues around that time. I made a bad choice one night and got caught, and I'm obviously paying a very heavy price for that. In my career for over 20 years, I was a pharmaceutical sales representative, traveled thousands and thousands of miles. I had the, last time I gave the information about my driving record, I hadn't had a speeding ticket or anything since 2010. I was always a very careful driver, very well aware of safety and all that sort of stuff. And yeah, made a bad decision, got caught. Thankfully, nobody was hurt. I've followed all the counseling. I've attended Celebrate Recovery, gone to AA meetings. I've done my community service. So yeah, I'm just waiting for August 29th to be off official probation from the Indiana court system.
Understand. We have the capability certainly to act on removing your probation. It's at our discretion to do that should we want to before that time frame, because we've got a month between now and then, but that's not very bothersome to any of us here, I don't think. So does anyone else on the board have any questions for her? She's done everything asked of her. Pretty much a one-off situation for her, and as she said, she's paid a pretty big price for that, and is ready to move on. Nothing. You pretty much told us everything, but we're moving right through this pretty quick. Do you have any kind of a closing statement that you'd like to make? You're offered that time frame if you want.
I appreciate your due diligence in this, and I appreciate everybody being respectful and professional about this. Like I said, this is quite an embarrassing, humiliating situation, but everybody's been very kind and very professional, and I appreciate that.
Well, our privilege, absolutely. Okay, thank you. These proceedings, according to notice, are hereby concluded. This cause is therefore adjourned until further notice. Thank you for being here for us. Stay with us, though. Discussion?
Just for the new members, there is board precedent where the board has taken somebody off of probation, even though they may not be completely finished with their criminal probation or their sentence. So this is within like 30 days. And the issue here was whether she had a drinking problem, and she's established that isn't an issue for her. So it's up to you guys whether you want to take her off now or wait. She's also not. She has a completely suspended sentence. She's not on probation. It's kind of a weird way they did that. The court did that.
However, otherwise, in a month, she'll be finished, but we won't be able to get back with her until October. So that's why I'm kind of in agreement or suggesting that we go ahead and take care of business now. What's that? Okay. I entertain a motion.
I move to terminate Graves' probation and reinstate her.
Okay, I've got a motion and a second. Any discussion on that? Hearing none. So let's vote. All in favor, signify by saying aye. Aye. Opposed, same sign. Congratulations. You're all set. Good luck. We don't hear you anymore.
Oh, sorry. Thank you. Thank you.
There you go. I see. I wanted to hear that. Yeah. Have a good day.
Thanks, you as well.
Good luck.